Hi Jessie, welcome to the School of Balance. It's great to have you here.
Hi, thanks so much for having me on.
No problem at all, it's wonderful. So I was wondering, maybe to start us off, if you'd be able to tell everybody who's listening a little bit more about yourself and what you do.
Yeah, absolutely. So I am a personal trainer and nutrition coach, and I specialize in training mostly women and specifically pre and postnatal women. So lots of women who are in their pregnancies and want to stay active and stay strength training, and then a bunch of women postnatally too who are trying to regain strength, stamina, and just put their bodies back together. So get rid of aches and pains and heal their cores. So that's the main gist of what I do. So lots of stuff surrounding strength training with women.
Oh, that's brilliant. And as as part of the pregnancy special here at the School of Balance, I think you were here really to focus on sort of that postnatal part and the rehabilitation. Um,
Yes.
But before we sort of get started around that, I wondered if you could just explain briefly a little bit about what the pelvic floor actually is and what problems new mums can have if they don't rehabilitate properly.
Right, yes. Yeah, this is such an important topic because I think that we don't have that great of an understanding of the pelvic floor. And so we think that a lot of the common issues that we see postpartum are just normal stuff that comes with having pregnancies or babies. And so it's important to know that lots of the issues that I'll discuss in a second are very common, but not normal. So if we are experiencing these things, we want to get help as soon as possible just so we can take care of them and they don't get worse further down the road. So the pelvic floor, if you think of your pelvis and then the bottom of your pelvis, that's the last spot in our bodies that holds stuff in. So we want to make sure that it's working with great tone so we can actually hold our pelvic organs in the right spots. That's the main gist of it. So we have these pelvic floor muscles that are right at the base of the pelvis, and they connect our pubic bone in the front with our tailbone in the back, and then our sit bones on the side of the pelvis. So we have this nice base of support connecting all those bony prominences. And then, yeah, so the pelvic floor muscles are these muscles that support our pelvis just to keep it really nice and stable and then support our pelvic organs, so such as the uterus, the bladder, the rectum. If we have good tone in those muscles of the pelvic floor, so not too tight, not too lax, then our organs are working really well and being held in the proper spots that we want them to stay in. So if we don't have balanced tone, say we have some areas after or during pregnancy or after pregnancy that are too tight or have scar tissue, or maybe some areas that are too loose as well, then we can start seeing some issues. So lower back pain, anywhere in the back really, upper back, mid back is very common for women too. Incontinence, so that we could be leaking urine or feces. Pelvic organ prolapse, which is when our pelvic organs start to literally fall down out of position and out through the vagina or through the rectum. So really important to understand where those muscles are, how we want to contract them properly, and how to relax them properly.
I mean, a lot of that, obviously, people talk around doing pelvic floor exercises. Is that the right approach? Is that the only approach? Do we just listen to our doctors, or is there more to advice than that?
Yeah. Um, I think that your doctor is a great first place to start. Uh, the only thing that is tending to happen now is that I'm hearing a lot of women at their 6 week checkup that don't actually have internal exams done, or they haven't even checked the C-section scar if they've had a section delivery. So I think it's just important to understand that our doctors are not pelvic floor specialists. And even if they do give us the go ahead that things look good in the pelvic floor, they just might not know exactly what they're looking for. They don't know if there's trigger points laid down in our pelvic floor or if our tears from delivery are healing as they should. So I always recommend to absolutely see a pelvic floor physical therapist within 6 weeks postpartum. And if it has been more than 6 weeks, just go whenever you can get there because they are so fantastic at making sure that things are truly working well in the pelvic floor muscles and throughout the whole body. So, yeah, they're a great resource for women and for men.
Brilliant. So basically, before starting to exercise again, go and get that specialist view, even if your doctor said everything's fine.
Definitely, yeah. And you can for sure, you can start exercising prior to, but I would keep it with the advice of a pre-postnatal specialist, or just keep it pretty gentle until you do actually get in to see your physiotherapist.
Brilliant. And I've heard you talk about diastasis recti. I'd like to understand a bit more about what that actually is, and also what women should consider before they're working on strengthening their core and their abs. I've seen a lot of challenges around Facebook around the 30-day ab challenge. If somebody's had a baby, are they okay to do that? If it's right, after the 6 weeks, all clear, obviously. But also later on, if someone's had a baby a few years ago, what's the viewpoint there as well, please?
Yeah, great question. So I would say if you have, or if you have a diastasis that you're trying to heal, or if you have had a pregnancy and a diastasis that is healed, uh, absolutely not for those ab challenges that you're talking about. Tends to be mostly what I've seen: sit-ups, crunches, double leg raises, front planks. And if you don't have a diastasis, you might truly give yourself a diastasis by doing one of those challenges because it is so much forward pressure and forward flexion on our abdominals. And essentially, in a lot of those exercises, we're forcing our abdominal contents against our abdominal muscle wall. And there's just too much pressure on the front side of that wall, and it can make our abdominal muscles start to bulge and separate. So diastasis recti is essentially that. It's very common in pregnancy, and it's a really normal occurrence of pregnancy. We just want to decrease the severity of this abdominal muscle separation. So once we get bigger in pregnancy, the fetus growing and the uterus is pushing against the abdominal wall, we have to have that happen. So that's why it's really just a normal occurrence of pregnancy. So the main thing is, though, we're not super concerned about the size of the gap anymore. If you have about a 1, 2, 3 finger separation along your linea alba, so that's the connective tissue from your sternum right down to your pubic bone that holds our two rectus abdominis muscle bellies together. So that gap can be, a few fingers width wide. However, what we're really concerned about is if our connective tissue, the linea alba, can actually create tension. So if our connective tissue can create tension, we still have a bit of gap remaining, but we can keep that tension in our exercises that we're doing, then we're good to go, where we've healed our diastasis. However, if we have this gap remaining and we can't create tension in the linea alba, then we're still in healing mode.
So if someone doesn't know whether they have this or not, basically it sounds as though during pregnancy, as we know, the abdominal muscles do move apart. Mm-hmm. It sounds fairly common that afterwards some people do have problems. But if people don't know, and they do have a bit of a mummy tummy or whatever you might want to call it, what's your advice? Can they work that out themselves, whether the tension's enough, or do they need to see a physiotherapist?
Yes, I would say the physiotherapist will give you a really good understanding of if the connective tissue is firing. And there's some really interesting stuff going on with ultrasounding now here in Canada, and I believe US as well. I'm not sure about UK, but with this ultrasounding, we can see if the connective tissue is doing its job. However, we can feel this too just manually on ourselves. So, the best thing to do is to start by testing yourself, and I can link a couple of videos to that after we're done. But that will tell you how to actually check to see if your gap is however many fingers wide. But you can also tell just by feeling the connective tissue if you have some areas that are a bit more hard, so they feel kind of taut, or if there's areas along the connective tissue, say right around the belly button, that feels pretty soft and squishy. That might be an idea that tells us the connective tissue isn't very strong right now. It's a bit too lax. So the best thing to do truly is just to start with really basic alignment exercises and breathing exercises to get us connecting our pelvic floor and our core muscles back together again. And that's really the first step, because we've probably lost the connection between our pelvic floor muscles, our abdominal muscles, and the deep muscles along the spine.
Okay, so it sounds like then from what you're saying that mummy tummy, whilst common, as you said at the beginning, might not be that actually normal or isn't actually normal. And there's things we can do then, starting with breathing exercises and so on. So what exactly should women be doing postnatally then in terms of exercise? How can they improve their pelvic floor and the gap within their abdomen to improve the visual appearance and also the stability of their core? It, is there do they need to go and get a personal trainer, or is there a good place to start on the internet?
Yes, there definitely is some great resources online now, and I can give you some more links to that as well. The first thing to do truly is to understand alignment and posture and really get into good alignment and posture all throughout our daily activities and throughout our exercise. That alone is an abdominal and core workout. So we want to get the body stacked in proper alignment, so our joints stacking right on top of each other as they should be. And that is the first step to even just allowing our core to be able to develop core stability and start to reduce that mummy tummy appearance. And then the second step in exercise that I give to everyone is the core breath. So the core breath is a breathing exercise that will help us learn to relax the pelvic floor muscles and the abdominals, and then to contract the pelvic floor and the abdominals. So that exercise is so important because we need both things to happen. Lots of women pre and postnatally, I think, often have a difficult time with the relaxation more than anything, especially if you're used to lifting weights or exercising. We're really good at knowing how to contract muscles, but the relaxation can feel tricky and hard. So the core breath will teach you how to do both things, and that in itself will start to heal that diastasis and close the gap back up.
Brilliant. And is there any exercise that women should absolutely be avoiding before they've done this rehabilitation? I know it's very tempting to sort of get back to what you were doing before, or even things you weren't doing before, to try and get your shape back. But is there anything that's going to do more harm than good?
Yeah, absolutely. So, really keep your activities low impact. So, no running, jumping, stuff like that. We want to just allow the body to heal, recover, and also just allow our soft tissues, such as our connective tissues, the ligaments and tendons, to return back to their normal tone as well. We don't want to be doing, as we were chatting about, the ab challenge type exercises. So crunches, sit-ups, front planks, or push-ups. Those I call front-loaded positions. And the abdominal wall in the front, it just won't be able to handle that forward downward pressure. So it's just going to keep bulging the belly out and separating those abdominals. So we want to keep ourselves in neutral spine, neutral alignment, and that's really just keeping that nice little arch in the lower back, nice tall upper back, and train the core in those positions.
Okay, no, that sounds great. So, I mean, the last thing you want is to make your stomach, protrude more rather than flattening it when you think you're doing loads of crunches to flatten it.
Exactly.
Brilliant. So moving on from exercise a little bit then, obviously women require good nutrition if they're breastfeeding. What are your top tips in terms of what this should look like, to make sure that you are giving yourself and the baby the support it needs, but not consuming extra than you require?
Right. I think the biggest thing here that we can do is just put our attention to proteins, fats, and fibers in every meal, every time we eat. So if we're hitting those things, protein, fat, fiber, every time we eat, then we're probably doing a great job at getting in daily requirements of vitamins, minerals, and just a great amount of protein to help ourselves keep energy high, to give good amount of protein to the babe. And then also with our fats, I think as women, we tend to be a little bit fearful of fats, but especially during pregnancy and postpartum, definitely with breastfeeding, we want to make sure that those healthy fat levels are high enough. And then with the fiber, we don't have to think of fiber in terms of starches or grains, although those are absolutely fine to have in your diet as well. But I would just prioritize our veggies for those fibers more than anything. And then I think main one is keeping the fluid intake high. So lots of water, lots of herbal teas. And then I think the last tip that seems to work really well for lots of my gals is one-handed foods and snacks. So maybe that's protein shakes or some protein bars that you've made at home or that you've found good varieties of at the store. Those typically are ones that can just be helpful for grab and go type stuff or when you're nursing and you need a snack.
That sounds like a very good tip. I think all new mums learn to do everything with one hand very quickly. Oh no, that's great. Thank you. So we've talked quite a lot about what people can do immediately postnatal if they find that they're, in order to make sure that their body is rehabilitated as soon as possible. What about, though, if women have had children many years ago and they didn't know this advice at the time? If they do have problems with the mummy tummy or pelvic floor issues, is it too late? Do they need to stop doing the exercise they're doing and follow the program that you outlined in terms of getting back to basics? What would you advise for someone in that case?
Yeah, I think that it's never too late at all. And I always say that postnatal is forever.
Well, that's good
So
news.
yeah, don't worry if it's been 3 years post or 25 years post. There's still so much we can do to help you feel better. So definitely anytime. And I would say it's going to be the same protocol really as what we start off with early postnatal. So it'll just be, again, going back to basics, fixing alignment, getting the connection between the pelvic floor and the core, and just rebuilding from the inside out. But any time is a good time.
Oh, that's brilliant. Thank you. So I guess it must be a real relief to some people out there. What I'll do is if you do post me over those videos and so on you've been talking about, I'll include them with the links to the interview so that if people do want to find out a bit more, they can do. And if they want to start trying to follow the advice themselves, they can do. But if they want to find out a bit more about yourself and what you do, where can they go? What are the details of your blog, social media, and so on?
Yeah, so my website is jessiemundell.com, and that's where I blog weekly and talk a lot about these topics and a lot of other stuff too. So I work with women online throughout the world doing distance personal training, distance coaching. So anyone in the world can contact me and we can discuss if they have further questions about this sort of thing. And then I also coach a postnatal group on photocracy. So that's again a distance coaching group for women who are looking to re-heal from the inside out postpartum.
Brilliant. Well, I'll include details of that as well in the interview if anybody's interested to get in touch to find out a bit more. Thank you. Mm. And just before we finish up, I try to finish these interviews with a quick fire round so people can find out a little bit more about yourself. Are you good to go with that?
Yes.
Awesome. So first up then, what's your favourite vegetable?
Spinach.
Good. And the last book you read?
The 5 Love Languages.
Oh, that sounds interesting. Your favourite relaxing and restorative activity?
Walking for sure.
Lovely. What's the one online blog or podcast you'd recommend, other than your own, obviously?
And other than School of Balance. Girls Gone Strong, such an incredible resource for women.
Agreed. I'll include the links to there as well. And how about your favourite treat food or drink for those times when you're just looking for something a little bit naughty?
Well, I wouldn't consider it naughty, but red wine.
Oh, agreed. One of my favourites. Well, thank you so much. It's been wonderful talking to you. And like I say, I'll include all the links for the people that want to listen to this when I post it back up on the blog in a few days.
Thanks so much, Sarah.
Thank you. Bye bye.
Bye.